Surveys have a very scientific basis, Mr. Speaker. My training is that of a sociologist, and surveys are extremely well conducted. In fact, the SWS is one of the premier social scientific survey institutions in the world, and most of these surveys have been conducted by the SWS. So I would just like to say that surveys are very carefully conducted. The statistical methods are quite sophisticated at this point, and they're continually being developed to points of sophistication so as to really probe where the population is at in terms of their thinking. So I do not share the view that surveys are useless. In fact, I think that surveys are extremely important as a mechanism for us to be able to determine where public opinion is. And the record of the SWS, by the way, Mr. Speaker, Your Honor, when it comes, for instance, to electoral trends, has been really, really quite good in terms of probing where public opinion is at. Like, for instance, in the last elections.
Mr. Speaker, while we are on the subject matter of surveys and open to the possibility of being converted into becoming a believer in surveys, may I ask our distinguished sponsor to give us these specific surveys, the when, where they were conducted, the questions asked of the respondents, the mechanics of the survey, and the results thereof, Mr. Speaker.
Well, just to give you two examples, Mr. Speaker, Your Honor, according to the 2008 National Demographic and Health Survey, 22% of married Filipino women have an unmet need for family planning services, an increase by more than one-third since the 2003 survey. Also relevant is the gap between desired fertility, 2.5 children, and actual fertility, 3.5 children, implying a significant unmet need for reproductive health services. Let me just quote you the latest SWS survey in June 2011. This is the Survey Institute Social Weather Stations headed by Dr. Mahar Mangahas, who is in fact regarded as one of the most sophisticated statisticians and surveyors, which says 82% of Filipinos felt family planning was a private choice and nobody should interfere with it. This was up from 61% in November 1990. The same survey had 77% of Filipinos saying the people should have access to government-provided information on all legal methods of family planning, up from 55% in 1990. Now, in terms of the sophisticated statistical mechanics of the survey, I would say that we would probably want to, if you could give us some time to provide you with that, we will consult the SWS. But it's they're fairly good. Hindi ho magic itong survey na ginagawa nila Dr. Mangahas. By the way, Mr. Speaker, the SWS latest survey shows the increase in the popularity of President Aquino. Does the gentleman believe this survey?
Pardon, I'm sorry, I didn't get the question.
You said that you had great doubt about surveys, but the latest SWS survey shows an increase in the popularity of President Aquino. Would the gentleman believe this survey?
Sometimes surveys may coincide with reality. I concede as much. But the survey itself, I still have to be converted to believe in the gospel truthfulness of surveys, Mr. Speaker.
Yes, Mr. Speaker, I would just like to say that yes, we are ready to be able to provide you with the mechanics of both the methods and statistics and survey. I cannot do that right now,
yes,
because we would need to consult the social weather stations. But if you might just have my assurance,
yes,
as a social scientist, somebody who has done statistics and somebody who has done research methods, and I've had to apply this in my 15 years of teaching at the University of the Philippines. Let me just assure you that we social scientists do not manufacture data. In fact, we social scientists, try very hard to be very, very accurate about what we report. So I would just like to assure you of that this is not magic.
Yes, Mr. Speaker, I would appreciate an opportunity, and if I may be allowed to reserve further questions specifically on the surveys that our distinguished sponsors are citing, so that we can examine what exactly were the questions asked of the respondents. Siyempre, pag itatanong mo sa may bahay ng mahirap, gusto ba ninyo na libreng kontraseptibo? Papayag sila siguro. Kung tatanungin mo silang gusto niyo ba ng kalusugan, siyempre papayag sila. And that's the reason why we have to be very wary of these surveys and not take the results or the reports of results, third-hand information, second, double or triple hearsay, Mr. Speaker. I think the public is being manipulated by a very clever media campaign to believe, to get the impression that the majority of the Filipino people want contraceptives, when in fact the questions may have been very different from the interpretation being fed to us by the distinguished sponsors of this RH bill. But yes, Mr. Speaker, I would appreciate an opportunity in the future in which I could study and discuss on the floor, hopefully, perhaps, the merits or demerits of these surveys that our distinguished sponsors are citing. The reason, Mr. Speaker, why I am very apprehensive about allowing the legal machinery, the legal system, using the machinery of government to push contraceptives, which in fact really is what contraceptive mentality means, is because historically, human civilization should already be aware that it leads to a decline of nations. Once a nation adopts a contraceptive mentality, it will inevitably decline. First, in the moral fiber of its citizens. Second, in the stability of its families, which are, even our Constitution says as much, the family is the basic cell of society. A contraceptive mentality will inevitably weaken the family, which is in itself a violation of our Constitution. And that has been the experience of the United States. If we remember, Mr. Speaker, that the pill was invented sometime in the late 50s or early 1960s, and the pill triggered precisely the sexual revolution. Free love, sex without responsibility, pure enjoyment. And that mentality of free love, sexual revolution, led to an increase in divorces. There are studies that I do not have with me right now, but if it comes to that, there are authorities, there are scholars, there are scientists who have proven that this kind of mentality has resulted in the weakening of the family, the increase in divorces, and ultimately demographic winter. And that is why many of our richer neighbors, richer countries in the family of nations are already trying to reverse. While we are trying to depopulate our country, our richer neighbors are spending precisely to reverse that trend, because they are becoming more and more endangered species. And we do not want that to happen to our country, Mr. Speaker.
Mr. Speaker, Your Honor, I appreciate the gentleman from Palawan's theory of history about the decline and fall of civilizations. But, Mr. Speaker, this is a highly personal interpretation. I think that most historians would agree, that the main factors have been failure to resolve the whole question of social equality, failure to be able to have an economic model that would continually generate wealth, failure at the level of politics. For instance, the United States went on an expansionist course that led it to severe overextension in Afghanistan, in Iraq, earlier in Vietnam. I think that this whole issue of the pill having created the decline of the United